babies. At a public hospital nearby, a group of doctors battle daily in the intensive care unit to save the lives of newborns.
Two things that struck me at Sion Hospital. One was, why are these babies dying? Why are these babies coming to our hospital? We could prevent them. The second thing that really affected me a lot is that we had small babies that were raped. A 6-week-old baby, I remember, was raped. And I said to myself, what is it we are doing? Finally, we only saved this baby's life. We are sending the baby back to the environment. I remember when I was the dean, I was walking down the corridor at midnight, and there was this woman with 2 small children, and I said, and a broken hand. It was in plaster. So I said, what are you doing here? I said, why aren't you going home? And she said, my in-laws have broken my hand. If I go back, they'll burn me. So I thought, in the hospital, we only look at the medical aspects. What finally happens to these patients? This is what made me think that, yes, I need to start something that will look at this aspect of it.
Appreciative inquiry is a management change concept, and SNEHA believes it in a lot, which talks about when you want to change an individual or a group, you can always build on their past history, which has some successes, and how to take it further and build your future based on.
To change the health-seeking behaviors of the slum communities and to improve service delivery within the public health system. Research is central to the way SNEHA functions, focusing on up-to-date data collection, evaluations of interventions leading to improved processes, and evidence for better health of women and children.
Future plan is really to integrate all the themes that we work with, which is maternal newborn health, the child health, family planning, sexual reproductive health of women and children, and prevention of violence against women and children, and offer it all together to the community and work on a community change model where the focus is really the family and not just the woman and the child.
SNEHA believes in encouraging slum communities to play an active role in bringing change within the community. Community resource centers will be established to offer all its services under one roof. Since its inception, SNEHA has touched the lives of thousands each year.
At the community level, we form women's groups within the community. Slums are different from rural areas, so the women's groups are not really in one slum, but every lane has its own small community, and these women's groups meet every fortnightly, sometimes every 3 weeks.
Hi, my name is Okila. I am a Sakhi. As a Sakhi, I make the groups.
Through a process of sitting together and talking about health issues, women sharing their stories about health. Every day there is a change that happens within them, and then finally they take their own decision.
Main concerns that women in urban slums face are malnutrition and anemia, just lack of access to antenatal care, the huge amount of domestic violence that they face in their homes, and just their overall sexual and reproductive health. Women in slums in Bombay really don't feel empowered to make any decisions in their life, whether it is on antenatal care, whether it's contraception, whether it's in the area of nutrition. So the problem really is about helping women feel empowered enough to access the healthcare that is available.
SNEHA's purpose is to influence policy and practice to improve the health of women and children living in urban communities. And it has always been our principle to work with the most disadvantaged populations. SNEHA believes in working with existing systems. So instead of starting services ourselves, we work with the Municipal Corporation of Greater Mumbai.
Malnutrition is one of the major concerns of the urban slums, where about 40% of children in the slums are malnourished.
We have a wide range of field staff who perform multiple roles. So on one hand, you have community organizers. They go house to house where they do pregnancy surveillance, and they also inform the mother of the various services and the facilities available for care.